Hello and welcome. This presentation is designed to help you better understand an important part of managing congestive heart failure, or CHF. We'll be talking about special minerals in your body called electrolytes, and how your water pills, known as diuretics, can affect them. Our goal today is to provide you with clear, helpful information so you can feel more confident and in control of your heart health journey. Let's start with a clear understanding of congestive heart failure, or CHF. CHF is a condition where your heart struggles to pump enough blood to meet all of your body's needs. It's a chronic condition, meaning it's a long-lasting, often lifelong illness that requires ongoing management. Because the heart isn't pumping as strongly as it should, fluid can start to build up in your body, a problem we call fluid overload. This excess fluid can lead to common CHF symptoms you might experience, such as swelling in your legs, ankles, or abdomen, and feeling short of breath, even during light activities. Managing this fluid buildup is a critical part of feeling better and staying healthy with CHF. One of the most important types of medication prescribed for CHF are diuretics, which you might know as water pills. These medications are essential because they work with your kidneys, which are your body's natural filters, to help them remove extra salt and water from your system. By doing this, diuretics increase the amount of urine you produce, helping your body get rid of that uncomfortable fluid overload. This process effectively reduces swelling and makes it significantly easier for you to breathe, thereby preventing hospitalizations and improving your comfort. Diuretics are a vital tool in helping you manage your symptoms and feel better every day. Now, let's talk about something incredibly important called electrolytes. These are not just any minerals, they are minerals that carry an electric charge when they dissolve in your body fluids, like your blood. You can think of them like tiny batteries or spark plugs throughout your body, constantly powering essential functions. Electrolytes are crucial for everything from ensuring your nerves properly send messages and your muscles contract correctly, which is vital for your heart muscle, to maintaining the perfect balance of fluids in your body and regulating your blood pressure. Key examples of electrolytes include sodium, potassium, calcium, and magnesium, among others. Keeping these electrolytes in the right balance is absolutely vital for your overall health and well-being. While diuretics are highly effective at helping your body get rid of excess fluid, they can sometimes have an unintended side effect. They can also remove some of these essential electrolytes along with the water. This means they can disrupt the delicate balance of these charged minerals in your body. It's also important to know that different types of water pills work in various ways, and therefore, they can lead to different patterns of electrolyte loss or imbalance. The most common imbalances we watch out for in patients taking diuretics are low potassium, known as hypokalemia, low magnesium, or hypomagnesemia, and sometimes low sodium, called hyponatremia. Understanding these potential shifts is the first step in managing them effectively. Let's look at the specific types of diuretics and how each one might affect your electrolytes. Loop diuretics, like furosemide, are the most potent type. They excel at quickly removing large amounts of fluid from your body. However, because they are so powerful, they carry the highest risk of causing low potassium, or hypokalemia, and low magnesium, or hypomagnesemia. Low potassium, in particular, is a major concern in CHF because it can lead to serious heart arrhythmias, which are abnormal and potentially dangerous heart rhythms. Thiazide diuretics, such as hydrochlorothiazide, are commonly prescribed, often as a first-line treatment for high blood pressure. They can also cause low potassium and low magnesium, though generally to a lesser degree than loop diuretics. Uniquely, thiazides can sometimes lead to higher calcium levels in your blood. Then we have potassium-sparing diuretics, like spironolactone. Their name is a big hint about how they work. They help your body hold on to potassium while still getting rid of excess sodium and water. Because of this, they can lead to high potassium levels, or hyperkalemia, especially in patients with kidney issues or when combined with other medications that also increase potassium. These diuretics are often added to a heart failure regimen specifically to help balance the potassium levels that other diuretics might lower. Finally, SGLT2 inhibitors, such as Jardiance, are a newer class of medication primarily known for blood glucose control, but they also have a mild diuretic effect. They generally have a neutral or even slightly positive effect on your potassium and magnesium levels. While low sodium, or hyponatremia, is a potential risk with SGLT2 inhibitors, it's typically mild and resolves on its own in most patients. Now, let's discuss what you should watch out for if your electrolytes might be out of balance. It's important to remember that these symptoms are often not specific, meaning they can be caused by many other things, including your CHF itself or other medications. However, they are signals that warrant your attention. For muscle-related issues, pay attention to any new or increased weakness, muscle cramps, spasms, or twitching, and unexplained fatigue that doesn't go away with rest. From a heart-related perspective, be aware of any new or worsening heart palpitations, which might feel like your heart is skipping beats, racing, or having an irregular rhythm. When it comes to your brain and nerves, watch for dizziness, feeling lightheaded, confusion, increased irritability, or sensations of numbness and tingling, especially in your limbs, fingers, and toes. Stomach-related symptoms can include persistent nausea or vomiting. And generally, if you're feeling unusually unwell, experience severe headaches, or have extreme thirst, these could also be signs. While these symptoms are important clues, it's crucial to remember they are not specific to electrolyte imbalances alone, and they don't tell you which electrolyte might be affected. That's why contacting your doctor is always the right next step. Given the importance of electrolyte balance, there are certain symptoms that should prompt you to call your doctor or healthcare provider immediately, rather than waiting for your next scheduled appointment. These include a sudden and noticeable increase in muscle cramps, especially if they are severe or don't seem to go away. Any new or significantly worsening heart palpitations, feeling like your heart is skipping beats or racing. A marked increase in dizziness or feeling lightheaded, particularly if it happens when you stand up quickly. New feelings of confusion, disorientation, or severe irritability. Persistent nausea or vomiting that doesn't resolve. And, very importantly, any symptom that feels significantly worse than usual for you, or is entirely new and concerning. These signals indicate that your body might need immediate attention, and only your healthcare team can properly assess your condition and determine the right course of action. It's absolutely crucial to understand why you should never try to self-diagnose or self-treat an electrolyte imbalance. As we've highlighted, many of the symptoms of an electrolyte imbalance are very general and can be caused by numerous other conditions, not just a mineral deficiency. For example, muscle weakness can be a sign of low potassium, low magnesium, or even high calcium. Heart palpitations can be caused by low potassium, low magnesium, or high potassium. Without proper testing, you simply won't know which specific electrolyte, if any, is out of balance. Taking the wrong supplement, or too much of a supplement you don't need, can be very dangerous and actually worsen your condition or create new, serious problems. The only accurate way to diagnose an electrolyte imbalance is through specific blood tests ordered and interpreted by your doctor. Your healthcare provider will use these results, along with your symptoms, to guide safe and appropriate management, ensuring you receive the correct treatment. You are a vital partner in managing your CHF and minimizing the risk of electrolyte imbalances. There are several concrete steps you can take to play an active role in your care. First, medication adherence is key. This means taking your diuretics exactly as your doctor prescribes, at the same time each day. Do not skip doses or double up without first talking to your doctor. Using a pill box or setting daily reminders on your phone can be very helpful. If you have any concerns about affording your medications, please talk to your healthcare team. They can often help you find resources. Second, daily weight monitoring is a crucial indicator of your fluid balance. Weigh yourself every morning, preferably after urinating and before eating, using the same scale and similar clothing. Call your doctor if you gain more than 2 to 3 pounds in one day, or 5 pounds in a week. Your doctor will provide you with specific target weight ranges based on your individual condition. Third, dietary management plays a significant role. It's essential to focus on a low-sodium diet, as salt causes your body to hold on to fluid, which then makes your diuretics work harder. Make it a habit to read food labels carefully, looking for low-sodium or no added salt options. Avoid processed foods, canned soups, frozen meals, and fast food, as these are often surprisingly high in sodium. Instead, use herbs, spices, lemon juice, and vinegar to add flavor to your meals. Also, avoid salt substitutes unless they are specifically approved by your doctor, as many contain potassium, which can be dangerous with certain diuretics. Fourth, hydration needs to be carefully managed. Discuss your daily fluid intake goals directly with your doctor. They will tell you exactly how much fluid is right for you, and remember that fluids include not just beverages, but also foods like soup or gelatin. Do not severely restrict your fluid intake without your doctor's explicit guidance, as this can also lead to other problems. And finally, regular lab monitoring is non-negotiable. Your doctor will schedule regular blood tests to check your electrolyte levels and kidney function. It is incredibly important to keep these appointments, as these tests provide your healthcare team with vital information to adjust your treatment plan as needed. Being an empowered patient means actively participating in your care and asking questions. Here are some proactive questions you might want to ask your healthcare provider at your next appointment. What specific type of diuretic am I taking, and given that medication, what electrolytes should I be most aware of? Could you please remind me of the specific symptoms of electrolyte imbalance that I should particularly watch out for while taking my medications? If I experience new or worsening symptoms, when should I call you immediately, versus when can I wait for a regular appointment? Are there any particular foods, beverages, or over-the-counter supplements, especially those containing potassium or sodium, that I should avoid or be careful with? How often will my electrolyte levels and kidney function be checked with blood tests? Your healthcare team is there to help you, and asking these questions is a great way to ensure you're fully informed and understand your treatment plan. Remember, you are not alone in managing your CHF and your electrolyte balance. You have a whole team of healthcare professionals supporting you. This team typically includes your primary doctor, your nurse, a dietitian who can provide personalized advice on your dietary needs, and your pharmacist who can answer specific questions about your medications and how they interact. Please, never hesitate to voice any concerns you have or ask any questions. Open and honest communication with your healthcare team is absolutely key to ensuring you receive the best possible care and achieve the best health outcomes. Let's review the most important points we've covered today. First, remember that diuretics, or water pills, are vital medications for managing your CHF, but they have the potential to affect your body's delicate electrolyte balance. Second, electrolytes are incredibly crucial minerals that power many essential body functions, including your heart, muscles, and nerves. Third, it's important to familiarize yourself with the potential symptoms of an electrolyte imbalance, such as muscle cramps, dizziness, or changes in heart rhythm. Most importantly, if you experience any new or worsening symptoms that concern you, communicate them to your doctor or healthcare provider immediately. Do not try to self-diagnose or self-treat. And finally, be proactive in managing your health. This means consistently monitoring your weight, taking your medications exactly as prescribed, following a low-sodium diet as advised, and keeping all your regular lab appointments. By actively participating in your care and working closely with your healthcare team, you can help ensure your medications are truly helping you live your best and healthiest life with CHF.